Hi everybody. Throughout the time I've been doing this vlog, I've been talking to you about dialysis and about what kind of my involvement is with dialysis. So I thought you might like to kind of see for yourself what dialysis looks like. I'm here at the clinic in Fort Walton Beach where I dialyze. I'm on what's called the third shift, and that starts from 3 and it goes until 7 approximately. And most of the folks who are here with me at this shift are people who work full-time. They're people who carry on there with their work and still come here 3 times a week to get their dialysis so that they can be feeling better. As you can see, I'm hooked up to a machine. The machine has 2 tubes that go to a catheter in my chest, and the catheter is kind of what they call my entry point. One tube takes the blood out of my body to the machine, to the artificial kidney. I don't know if it's probably out of camera range right now, but Robin will show that to you later. And the other tube, the blue one, I think, I might have that backwards, brings the clean blood back into my body. It takes about 4 hours, although I got a big thrill last time I was here because my doctor told me that I was doing so well I could actually get off 15 minutes early, so that was like Christmas. I was so thrilled. During dialysis, you pretty much are stuck in one place. You sit in these nice big comfy recliner chairs. I'm fortunate that I can bring my laptop and I get a lot of work done. I hope my boss is watching when I say that. I get my work done on my laptop. You can't use cell phones, so that's a little bit hard because you're cut off from people that way. We also have TVs that hang over from here that you can watch Jeopardy or whatever your favorite show is. And thanks to my cousin Randy, who generously lent me his portable DVD player, I get to watch a DVD every day. I also try to read and maybe knit or crochet or do something like that to pass the time. But I wanted folks to see what dialysis is all about. And in a minute, I think my wonderful nurse Dolores and my technician Ramona will tell you about some of the technical stuff that's involved with dialysis. So this is all part of this journey that we're going to be chronicling, and thanks for your interest and your time. I also introduce you to my friend Ramona, who I call my dialysis goddess. She's a technician here at the center, and she's a wonderful help. She gets patients on and off dialysis, and she makes sure that our machines are working properly and everything. You want to say hi? Hi, Ramona?
Hi. The most precious gift you can give is the gift of life. Be an organ donor. We love you.
Thanks, Ramona. I was going to introduce everybody to, I call Ramona my dialysis goddess, and this is my dialysis princess.
Oh, so sweet.
Yes. Dolores is the nurse who takes care of me on dialysis and gets me hooked up. It's not a complicated process, but there's a lot to it. You want to talk a little bit about what's involved, Dolores?
Well, basically what Kelly does is we come in and we do our vital signs and we get her weight and we calculate how much we're going to pull as far as fluid-wise based on, the amount of fluid she puts on in between treatments. But what we pretty much do is we instill heparin into the quarts of those so that they stay patent. And then we just withdraw that small amount out each time so that the heparin doesn't go back into you. It has a short half-life, so it's not like you're going to have a chance of having a really, a big exposure to having a lot of heparin. The risk of that would be, thinning blood. So they come in, and so then we just basically we've already got our machines built here. We've primed them with saline. We've got we put a set amount of saline into here, like 300 to 500 milliliters.
What kind of patient is Kelly?
She's good. Kelly's a wonderful patient. She's very sweet, very kind. She normally brings me my papers on Wednesdays. She forgot today. So I'm making her